Good afternoon, everyone. Welcome to the October 2021 edition of Green Infrastructure, Climate and Cities, a monthly webinar series focusing on the unique challenges that climate change poses for cities and what we can do about it. My name is Franco Montalto, and I'm a professor at Drexel and one of the lead PIs on the Consortium for Climate Risks in the Urban Northeast, a NOAA-funded team of researchers and universities focusing on climate change's impact in the Northeast US. For those of you joining us for the first time, this seminar series has been going on since 2014. We live cast, record, and archive all of the previous sessions and this session as well. Feel free to go to the CC Run website to check out any of our previous seminars. For those of you seeking continuing education credits, you can email us and we'll get you that information. Just a reminder, during the seminar, please use the Q&A box to submit questions. You can also upvote other questions and raise your hand if you want to ask a question orally at the end. The chat is just for technical information about any problems you might have with using this. As we do every month, as a small act of respect and honor, we begin these series by reminding ourselves that these important conversations are happening here on the historical homeland of the Lenape peoples, who, after centuries of oppression, are today dispersed throughout the US and Canada. And we sincerely hope that these discussions, as well as the discussions we've had in previous seminar series, can help us to better care for this small corner of the world and its people with the same respect and care that were historically demonstrated by the Lenape. So the title of this week's seminar is A Coalition Around Heat Research in Charleston, South Carolina. The work that will be presented is a collaboration of multiple researchers working in different capacities, as you'll hear, including partners from CC Run's sister RISA team, NOAA-funded research team in the Carolinas called the Carolinas Integrated Research Assessment, or Cisa. So the team that you'll hear from today are pictured here. Dr. Janice Barnes is a founding partner of Climate Adaptation Partners, a New York City-based woman-owned business emphasizing adaptation planning, advocacy, and partnership building, and prioritizes the relationship between climate change, design, and public health. Followed by Dr. Kirstin Dow, the Carolina Trustees Professor in the Department of Geography at the University of South Carolina. So Dr. Dow is a social environmental geographer focusing on understanding climate impacts, vulnerability, and adaptation using methods involving extensive participation of stakeholders and decision makers. Dr. Dow will be joining us a few minutes late. Third, we have Dr. Jennifer Runkle, an environmental epidemiologist who serves as a research scientist at the North Carolina Institute for Climate Studies. Her research is focused on using causal science to rapidly understand how, when, and where local interventions may be leveraged to reduce climate health inequities in at-risk communities. Dr. Maggie Sugg is an associate professor in the Department of Geography and Planning at the Appalachian State University, and she works at the intersection of climate and health. And finally, Dr. Charles Konrad, a geographer, meteorologist, and climatologist who studies extreme weather and its impact on society. Dr. Konrad directs the NOAA-funded Southeast Regional Climate Center, which provides a wide range of weather and climate services and expertise for that region. But those of us in Philadelphia know that we have our own need for research into extreme heat. And we've decided to kick off this session with an introduction by Ms. Jody Reinhout, who is the Senior Vice President of Community Engagement at Esperanza. Esperanza is a faith-based organization focusing on empowering those on a pathway out of poverty in the Hunting Park section of North Philadelphia through a variety of programs that cultivate self-belief, grit, and knowledge acquisition. Ms. Reinhout oversees the Esperanza's Housing and Economic Development Department and the National Programs Department, and she also oversees their Impacto newspaper. Drexel's been working on heat-related issues with Esperanza for the past 2 years, and to kick off the session, Ms. Reinhout will describe some of this collaborative work, also speaking about, in general, about the heat challenge faced by Hunting Park neighborhood, before handing it over to Janice to then facilitate the remainder of the run of show. So with that, I will stop sharing and hand it over to Ms. Reinhardt.
Thank you so much, Franco, and thank you so much to my colleagues in South Carolina for giving us some space in this dialogue today to talk about the work that we've been doing. We know that many urban communities are facing similar challenges, and that only by working together and sharing lessons learned can we begin to make the really important difference in people's quality of life. And so I'll just speak very briefly about the collaboration that we've had with Drexel and Hunting Park. As Franco has mentioned, Hunting Park is a largely low-income, predominantly Latino and African-American neighborhood in North Philadelphia. And Esperanza is a community economic development corporation, a nonprofit organization that has been here in this neighborhood for 35 years, working on community-based solutions to a variety of different kinds of issues. We do education, economic development, and render a number of other types of programs and services to work on place-based development and revitalization. And so what we've been working for several years on the conditions in Hunting Park. And as we know, Hunting Park is far, far hotter than the rest of the city on average during our heat seasons in the summer. And this is a result of historic disinvestment, of a lack of green environments and infrastructure to help bring those temperatures down. And so what we've done with Drexel as our collaborator over the past couple of years is really what's important about the approach is that we've taken a two-pronged view of this challenge. We obviously want to help bring interventions to the community that will help them with the immediate problem of the heat challenge in Hunting Park that affects obviously their health, their ability to get out and be physically active. It affects social cohesion. We know some of those incredible impacts that we need to intervene in now to help people live healthier and better lives. And so, and we do that in partnership with community residents and leaders on a block level. For the past couple of summers, we've been implementing structures that are heat mitigation structures, things like benches, planters, umbrellas, water features on a block by block level that can help folks with the immediate need. But I think one of the really incredibly important things we've done with Drexel is to also look at the long term. How do we not only gather data and apply that to the interventions that we're creating for the neighborhood, but how do we also create a body of data within our neighborhood that we can use to be strategic, but also to share with other colleagues and partners and to help us exchange these lessons learned and best practices that will make us all more effective. And so as we think about from summer to summer, how can we implement these immediate interventions at a greater scale across the neighborhood? But how do we also expand tree canopy? How do we invest in the infrastructure, both the built and the natural environment, inside people's homes and outside people's homes, that will help them to deal with climate and the experience of climate in our neighborhood? We really do need access to the other colleagues and partners in the space, Drexel University and others who can help equip us with research, with data to bring to bear on the strategies that we develop, because it's our goal, of course, to transform this neighborhood in a way that will really impact quality of life for low-income and disadvantaged people, create a green environment for them, and create sustainable solutions that will lessen the challenge that we face each summer over the years. So we're really excited to be part of this conversation and the broader collaborative of folks that are at the table today. We're looking forward to learning, sharing, and helping to advance this important agenda along with Drexel and our colleagues on the call today. Thank you.
Thank you, Jody. That was really great. Just to sort of frame some of the folks in the audience today from Philadelphia, sort of looking to learn from the Charleston example. So with that, I'd like to thank you and hand it over to Dr. Barnes to take over the run of show.
Thank you so much. And it's not that far away. I mean, with the climate perspective that we're seeing, this Charleston experience may be in Philadelphia by the end of the century, right? So everything looks okay there, Franco? Or
Yep, perfect. Yep,
okay,
absolutely.
Great. So I'd like to share a little bit of the context of the work that you're going to hear about today, and just encourage you that if you have questions as we're going along, pop them in the Q&A box. We have also a slight switch. Kirstin had a little bit of a challenge with our seminar, so she'll be joining us a bit late, as Franco said. So I'm going to walk through her slides as well to try to do both of those in the less than 15 minutes. So to start, I want to talk about this collaboration, this coalition that's formed up, and just hashtag sharing is caring, never meant more, because it's truly the work of so many people. Let me just get this moving. So Charleston, a relatively small city, had completed an all hazards vulnerability assessment, flooding frequently and walking through feet of floodwater frequently, seismic issues and vulnerability, water shortage, hazmat. In many cases, those are already handled, but extreme heat was not. And I come from the South, and one of the things that we keep saying is you can't walk through 3 feet of extreme heat. You can deal with the water because it's what is in your way at any one time. So in working with the Charleston Medical District across the issues of the all hazards assessment, we're trying to raise up issues at the same time the city is putting their sea level rise strategy out and showing the kinds of potential that you see on these maps. And you're experts in flooding. You know what these rising water diagrams actually mean or could mean. And there was so much work ongoing. This is just a snapshot of the last 7 years of activities. And until 2020, there was no work on extreme heat in the city. In fact, in the area where we're working, in the Charleston Medical District, there were over $2 billion of planned investments, wonderful projects that dealt with not only patient care, but also trying to deal with the floodwaters. But none of those, with the exception of some work that the Arboretum was trying, really dealt with heat. But we know that heat's a problem there, and it's a growing problem. And when you look at Charleston Metro, you see that the peninsula, where the medical district and other critical facilities are, it's certainly a big problem. And when you look at the issues around life expectancy and compare those to heat and the kinds of issues that Jody was just talking about, also a big problem. So Kirstin put this slide together. It's basically trying to highlight from the U.S. Climate Resilience Toolkit, what are we really talking about here? And we're talking about a doubling of the number of extreme heat days, or possibly even a tripling of the number of extreme heat days. And that's over 90 degrees with a really high humidity. And when we look at the long view of investment service life and go back to that $2 billion of investment in the Charleston Medical District, there's some big water projects coming. But again, we didn't have real focus on how to deal with the heat transition during that same time. So we were really fortunate to have great collaborators with the medical district as we were doing a series of activities to try to raise up resilience more broadly. We did a sampling exercise. Jeremy Hoffman, who's a colleague, gave some good advice on how to use the FLIR tools that he started with, and we also coupled that with a bad elf to geolocate. And we did a test protocol, basically saying all these places where you're going to be walking, let's also think about what the patient experience is from heat. So as you're prioritizing trying to get dry feet, let's also try to prioritize cooling it down. So the purpose of this work was just to get a sample, again, trying to break into that issue of flooding with a complement, water and heat. And this is the kind of day that we sampled, typical day in August of 2020. The temperature, wind, humidity you're seeing here is pretty common for Charleston. And in sampling, super simple. In fact, the first time I showed this to Chip and Kirstin, I was saying, oh man, they're just gonna think these data aren't rich enough, but fortunately they were willing to play along. But what these diagrams and what these photos did and the surface sampling did was to create a space for a conversation in a city that is dealing with such difficult flooding issues. And when you begin to see that your choices, places you're trying to make things better, are actually worsening the microclimate because of unexpected material responses, it does create room for that conversation to happen. And even sampling across the material palette within the medical district was really important. Now, this is happening at a time that the three entities, Veterans Administration, Roper, and MUSC, were doing master planning. And we were trying to kind of encourage the master planning teams to think more holistically about how heat becomes a criterion in the master planning process as well. So you have a lot of good intentions like these, where you create these nice places for people, but these places in some cases are creating very inhospitable microclimates. In fact, this issue came home really hard when 2 patients passed out on their way to this building on the left on extreme heat days. So the physician who was working with us raised the fact that he had received 2 separate pager calls, 2 separate patients who had had a real problem just getting from their car to their appointment. So this context allowed us to run a charrette, and we were really fortunate that Chip and Kirstin were willing to join that charrette and raise up the issues of extreme heat and some of the work that they'll talk about here today. Now, this again was previously identified through Fernleaf Interactive's work on the vulnerability assessment for the city. But when you're a Southerner and you're walking through that much water, it's really hard to get the heat conversation in there. So what we're going to talk about today is really 2 programs. One is what we're calling the Cisa heat research, which Chip will talk about in terms of wet bulb globe temperature, and Jen and Maggie will talk about in terms of some personal monitoring devices, and then we'll talk a little bit about the NOAA Heat Watch research program. And I won't steal their thunder, but they have some really cool tools, which we'll be happy to share at some point. And again, the reason we were trying to do this was to try to motivate local action. One, increase awareness of extreme heat exposures as those relate to patient health, but more broadly within the community as well, to increase coping capacity, increase mitigation opportunities, and to increase the adaptation work to be inclusive of heat, water, and this work came with an incredible network of collaborators. So kind of like the movie High Fidelity, we organized this autobiographically. So the order of this is really the order in which team members began to join this coalition. And I can't thank this group enough for allowing us to create the room for this work to happen. I wanted to stop on this slideshow and toggle over to the work that Kirstin would be sharing. I don't think she's been able to join us yet. So Kirstin was introduced to us through South Carolina Sea Grant as we were pursuing a Robert Wood Johnson Foundation grant for trying to figure out if we could do an oasis, right? If we could take some good lessons learned from what Paris was doing with their green schoolyards and test that in some of these areas where patients and staff within the medical district needed areas of respite. Could we think about that? And this again was in the context of COVID. So could we think about this as an opportunity? And while we did not get that grant, it was a catalyst for bringing these conversations together. Now, the medical university is one of the largest employers in the area. It comprises the entities we're talking about, and it has an enormous amount of foot traffic through it, not only the people who are there for care, but also the physicians, the staff, and the other organizations that support that. It's also situated right here, Ashley River, with an incredible problem, not only with storm surge issues, but also with inland flooding, so the pluvial flooding. So this is the context. And these are streets of Charleston where you can kayak on certain days. And the city's really struggling. They have an enormous amount of water work, from improving catch basins and small scale, getting them cleaned out, to the enormous scale of the U.S. Corps' effort for a storm surge barrier to protect the peninsula and its many assets. So trying to get that important conjunction "and" in place is one of the hardest things to do when you're trying to deal with things like you see on the screen. we're really fortunate in the collaboration that Chip and Kirstin brought, as well as the work that Jen and Maggie have done to kind of broaden the resources. So this is Jordan. He's a postdoc with Chip, and Chip will talk a bit about that. But when Kirstin, we had this first conversation, what ended up happening was she said, well, there's some other folks that you should know. So she brought in Chip, he brought in Jordan, she brought in Jen, she brought in Maggie, and then Scott Curtis had just joined the Citadel with a new center on climate studies. And Kirstin brought in one of her graduate students as well. So this is the beginning of this growing set of collaborators to say, how might we begin to look at this in an empirical way? And who do we need to have involved in order to advocate and move that forward? So this again is building on the issues of patient care. So if you're in a situation where you are trying to advocate for something that feels in some ways it's drawing attention from what's really important, like why are you talking about this heat issue when we're flooding and we can't get our patients to their appointments? So it was super important to get the medical community fully involved, beginning with Dr. Susan Johnson, who was a key collaborator in that initial grant proposal with Robert Wood Johnson. She brought in the Office of Health Promotion, the City Wellness Committee, and then Dr. Jerry Reeves, who's with the MUSC Arboretum, who began to be and is still an enormous factor in this, getting the word out with local news, where he is a trusted voice. And he's also the chair of the Arboretum Board. And then we also worked with, and Jen and Maggie will likely speak to this as well, but we worked with groundskeepers as well as public safety individuals. And again, each of these relationships came from the ones I just told you about. And I think one of the key takeaways that I would just have here is this iterative building of relationships is one of the major takeaways of this process. There was not a heat related network in place. So we're building this network, and in doing this, it really opens up the arms and brings in many, many more collaborators than the very technically specific flood work was allowing to happen. So we have an incredible number of physicians who are able to help. We have the lead for public safety worrying about her team and their professional gear. And we have folks who have groundskeepers who are really thinking about how they change schedules. Excuse me. And we also have an incredible advocate within Christine von Kolnitz, who is with MUSC Sustainability and has done so much work on behalf of this. I feel like this entire talk could be here all the people who are collaborating, but it is such an important part of the work. As this began to grow and as we moved into the work with Heat Watch, the partner organizations broadened even further. And with the Heat Watch program, it was the first time the state of South Carolina had actually sought to measure these issues. So while Heat Watch has been active for a number of years now, in 2021, we ran the Heat Watch for Charleston, peak heat in the end of July. And we were running this as well with some folks in North Carolina. So hopefully we'll have the Carolinas Heat Watch results ready to share with you soon. The great thing about this collaboration has been that the media that has been so good about reporting on flooding in Charleston and South Carolina in general has stepped forward to focus on heat. I mean, having the meteorologists get the word out, because Dr. Reeves has spoken with them to say, hey, this day is going to be a little different. It's a little hotter this time of year than it typically is. Make sure you're prepared. And then broadening out to include the aquarium and the health professionals and DHEC, the Department of Health and Environmental Control Health Preparedness Unit. It is an incredible expansion, and it's really required. It is absolutely required to have this kind of collaboration to make transformative change happen. So there's some really interesting connections beginning to happen across the faith-based communities as well as the medical community. There's more news. We have a number of writers within the Post and Courier who are raising up this issue, making it really accessible to the general public. The group here in the red box co-authored a commentary to try to get the word out as well. And so what's happened? The Charleston Medical District has integrated heat more fully into its overall resilience conversations, asking all those master planners to consider not only the experiential side, but the power dependency side. The city comp plan is now inclusive of a heat component. MUSC, largely from Dr. Reeves, Susan, and Kirstin, have now declared a heat awareness month. The Tourist Bureau is talking about guide training and some hydration stations to help tourists have a place to stop and cool off. And Kirstin is now working with Columbia to not only broaden the heat watch efforts, but to broaden the heat research more generally. And I think that she'll be able to speak to that when she's able to join the call. So I'll stop there and I'll stop sharing. And I want to turn now to the specifics, because I think that's probably what you all have tuned in for. Jen and Maggie are going to co-present this. They've done some extraordinary work on the personal monitoring, and it's really inspirational to not only hear what they're doing with this work, but to also read some of their previous work. So if there's interest in that, we can share those articles as well. Jen and Maggie.
Hi, can you see our slides and hear us? Okay. Jen and I will be tag teaming this presentation. We've been working closely together since 2016 on a variety of climate health issues, predominantly in the southeastern US. Today, we're really going to try to provide a framework, discuss some of our previous work and how we're using it to inform our work in Charleston. And we just got our results about a week ago, all compiled together. So you'll see some of our initial results from this particular project in Charleston. But first, to begin with, to kind of frame this work and the need for this work, a lot of the health and climate work has been focused on an ecological scale, meaning, a lot of our health outcomes are based off residential location. And using this type of methodology, we see really important patterns. Like for instance, this is an example of some work we did with Dr. Konrad showing heat-related illness across North Carolina. And you can see a lot of heterogeneity, even across a state like North Carolina, that has a lot of really high temperatures and humidity. But one of the limitations of this type of research design is we have to link our health records to weather stations, and often weather stations can be a pretty large distance away from a residential location. And so this is a map showing all the hourly weather stations in North Carolina. One of the problems in North Carolina, I know this is about South Carolina, but in North Carolina, where we've done a lot of previous work, is that we have really poor coverage in rural locations. And these rural locations are also locations with a lot of heat illness and heat burden. And in geography, so my PhD's in geography, we kind of coined this problem of the mismatch between residential location and exposure, the uncertain geographic context problem. So we're not really getting at where and when exposure occurs. We're not taking into account people's time activity patterns, their occupational status. And so we're not really getting a clear picture of that exposure as well as the corresponding health outcome.
So Maggie and I teamed up around looking at, what's the potential of using personal monitoring like eye buttons and these like new wearable technology to better get at that individual experience of temperature. Next slide. At the time in 2016, 2017, when we were first just getting started on this idea, there had been a few studies ahead of us that had been primarily focused in urban areas and had really relied on time activity diaries and surveys to get at that, how a temperature experience was related to an individual's microenvironment. So Maggie and I took a step back, and I'm an environmental epidemiologist. We paired up with Dr. Chris Furman, who's a climatologist at Mississippi State. And we thought, what if we take a quick look at 3 locations, an urban, primarily urban, hot and humid location in Mississippi, a really high heat location, we chose Raleigh, and then a rural location, and we decided on Boone, and we each approached our grounds workers division at our universities, pitched the idea and wondered if they'd be willing to partner with us. And so essentially what we wanted to do to kind of look at vulnerable outdoor workers was to go beyond just collecting the eye button, that individual experience of temperature, and pair it with how a worker changes their location throughout the workday, and actually be able to measure heat or physiologic response in the worker as they change location and experience different ranges of temperature. Next slide. So we've done a lot of research looking at the ways in which eye buttons can be used to characterize hot ambient temperatures in outdoor workers. We had so much success partnering with each of our outdoor worker groups. They wanted to kind of take a look and see what their exposures were in the cold. And so we did a follow-up pilot study in 2018 looking at cold exposures. You know, what's really a unique advantage of using eye buttons is not only does it help us, you know, with temperature misclassification, but it also is a really unique way to engage those vulnerable at-risk groups around understanding heat as an occupational hazard and engaging them in conversations about what they can do to reduce their exposure. And so one really important aspect of our work was the reporting back of these environmental health data to the workers and to their managers. Here's what the temperature experience looked like. Here's ways that you can modify your workplace behaviors or breaks or increase heat training. And so the report back was kind of a unique aspect for some of this research. Next slide.
So just again, providing framework for some of the previous work. This was a study done across the 3 locations, looking at eye button, so individual experience temperature at the individual level at 3 locations relative to the weather station. So seeing how much those temperatures differ to traditional sources of climate data, like your weather station data. And what was interesting about this study that we did in 2016 is it corresponded with a heat event. So there was a heat advisory. And what was really particularly interesting to us was that during these heat advisories, when you had a heat warning, we actually saw a reduction in the individual experience temperature of workers. So when there was a heat warning, they were paying attention to that heat warning and mitigating their exposure. And to us, that was really interesting. But conversely, outside of those advisories, they were still experiencing really high temperatures and just climatologically normal conditions. So in the Southeast, Charleston, just like Charleston and these other locations, they were still experiencing very high temperatures and corresponding heat strain, which Jen will talk about. But each location had a different exposure misclassification relative to the weather station. So meaning that there was a greater or less difference with the weather station. So App State, which was the location of Boone, had much higher temperatures than the weather station, whereas Mississippi and North Carolina State had a little bit lower temperatures. But to me and to us, our group, the main interesting finding was, again, that heat advisory was something that the workers were listening to and mitigating their exposure.
Sorry, team, I lost the mute button. So just as Maggie alluded to, not only were we interested in the how well individual experience temperature matches the weather station, but we also wanted to look at those personal, occupational, and behavioral factors that influence physiologic response to heat strain. So we borrowed liberally from industrial hygienists two measures to approximate heat strain in our population. First was we relied on heat strain, anything, a sustained heart rate above 180 beats per minute minus the individual's age. And then we also calculated heat stress, which was just a maximum heart rate over 145. beats per minute. We collected a number of data points from the workers in a baseline survey, including important demographics, as well as their workplace history. Had they ever received heat prevention training? What were their perceptions of heat as an occupational hazard? And even some behavioral endpoints. Did they use personal protective equipment? Did they take rest breaks or use the shade, or take a break in the shade throughout their workday? So next slide. I think for us, one really interesting finding was that there was a real mismatch between the perception of heat risk and their actual experience. So our Mississippi State was our high heat and humidity exposure group. They had the lowest perception, but yet the highest number of workers who experienced heat strain throughout the study period. Next slide. We also wanted to look at time to event or time to heat strain for workers. And we loaded all of these risk factors, individual demographics into a Cox proportional hazard model. And really high level, we found, just as expected, higher ambient temperature. For every 1 degree increase in temperature, there was a 3% increase in heat strain. Curiously enough, workers who reported that they had a place to cool off had a higher risk of heat strain, and those who had higher educational attainment also had higher risk. I think that largely what's driving the risk behind having a place to cool off is that workers, again, there was this mismatch in actual experience of heat and their perception of it as an occupational hazard. It's like this thing that I have to work out, outdoors every day. It's just my job. And we think largely the reasons why we saw excess risk in those with higher educational attainment was that these primarily managers who work more, in the office indoors, when they were going outdoors kind of intermittently, they were acclimated as much. And so we saw a little bit higher risk. And then for protective factors, we found that the older the worker was, which I didn't include this, the older the worker was, the lower their risk of heat strain. I think older workers in particular were very aware that heat kills and it is a danger, and we're taking precautions. And those who experienced a severe heat symptom in the 2 weeks prior also had lower risk of heat strain. Next slide. So we know that the relationship between heat and health is likely nonlinear, and we applied the distributive lag nonlinear model, or essentially a relatively new modeling strategy to look at the cumulative and nonlinear effect of personal experience temperature on heat strain. Next slide. And so this is just looking at the relative risk of heat stress for all of our workers combined. And we saw excess heat stress between 85 to 95 degrees during their normal work week. Next slide. And just as Maggie alluded to, we also took a closer look, using this GPS location data, were workers modifying their behaviors during National Weather Service heat advisories. And in fact, we saw that the risk of heat strain was much lower during weeks in which a National Weather Service advisory was announced. And it was actually, we found a higher risk during those kind of seasonally higher than normal, but not yet a weather advisory issued. Next slide.
Okay, so we know this is a topic on heat, but we also replicated the same study protocol for the cold environment. And even though, the Southeast isn't as cold, a lot of our worker groups, we had a really strong partnership for them. A lot of them were more concerned about the cold weather rather than the hot weather. So we took that same protocol and applied it to a cold environment across a 3-week period, looking at only 2 populations, one in Boone and then one in Raleigh, North Carolina. So Boone's located in the high mountains, cooler temperatures. Raleigh's in the Piedmont, a little bit warmer temperatures. And what we found was kind of interesting. Workers, kind of like heat, workers experienced more cold symptomology and not very cold temperatures. So in some of moderately cold range, particularly when there was, it was kind of damp out and they were outside for long periods of time. This is when we would see greater cold symptoms. And really curiously and interestingly, we saw more cold symptoms in our warmer climate, the Raleigh, North Carolina population, rather than the Boone location, which is in the higher mountains, much colder temperatures. So this really just highlights the kind of, fine scale patterns and, climate and health effects you can investigate with this type of individual level analysis. And again, this is using a similar modeling framework, the distributed lag nonlinear model, that looks at both intermittent and cumulative exposures, but rather than applied to heat, applied to cold in the winter time period. So as a summary of our previous work, before we begin talking about Charleston, we've found through several publications and several different protocols and testing of multiple populations that this type of personal monitoring devices, so using these small eye buttons that are about $20, are a feasible method to characterize environmental exposure. And again, the workers traditionally just wear them on their collars, and we used a safety pin, really easy for them to just attach and make sure to face outwards. We saw significant variability among each occupational group, as well as across different time periods and weather events. We were really surprised to see that workers are modifying their exposure, really encouraging. So warnings are working. That's great to hear, especially for people associated with the National Weather Service. We also saw that workers were spending more time indoors during cold winter hours. So when the temperatures really would drop, they would spend most of the time indoors, as well as in extreme heat events. So perhaps focusing in more on these shoulder type temperatures. So, climatologically normal, but very hot or moderately cold could be another area to target some of these health interventions to prevent heat and cold symptoms, as well as heat strain. We found that moderately cold environments were risk factors for cold health outcomes, whereas heat stress and strain were actually maximized in the most extreme conditions. So we saw the most heat strain in our Mississippi location, which was the most humid, the most hot. And so we're showing you all this to kind of highlight what we're trying to do in Charleston. We just got our results all together, all merged together last week. So we don't have as much in depth to show, but we are working towards it. And Charleston will be a new study site for us, looking at 3 populations, one at the Citadel, and then MUSC, the groundskeepers, as well as the public safety. So we have a different occupational group. All of our previous work was focused on grounds workers, but we're including public safety as well in the Charleston project.
And just as Maggie and Janice have so nicely set the stage, we were invited by Cisa and the larger Charleston Medical District to kind of replicate our prior protocols and see, can we leverage this personal monitoring in Charleston and outdoor workers. So we first just wanted to look at the spatial and temporal variations in heat exposure across our 3 work groups and our 3 kind of actually 2 geographically distinct areas within Charleston. We wanted to investigate, take it a step further. We were able to incorporate relative humidity in addition to temperature and calculate sustained heat index. And draw some connections between heat index and physiologic heat strain. And then lastly, just look at those individual and behavioral and occupational factors using GPS location and worker self-report to see, can we identify risk factors and even resilience factors for these workers in Charleston? So we approached, again, Janice talked about the many relationships that were established, made connections with these three worker groups, and they agreed to allow us to provide really a 30-minute high-level overview of what we're hoping to achieve in our study and recruit their workers to participate in 5 days of data collection. So just 5 days of their regular work week. And we wanted to time the personal monitoring study with the urban heat island, potentially mix and match some of those data. We showed workers how to use the iButton temperature. We allowed them to opt in to the Garmin heart rate and GPS portion of the study because not all workers feel comfortable with allowing researchers in particular tracking their geolocation throughout the workday. And we collected activity logs just to give us a better sense of some of these temperature and relative humidity experiences we were actually logging for workers to help contextualize. And at the end of each day, workers were asked to complete a temperature or to complete if they had experienced any heat-related symptoms. And again, this is just the iButton and the Garmin Vivo Active Watch that allowed us to track heart rate, GPS location, acceleration, velocity, and a few other measures.
Okay, so this is getting into our Charleston data. So we, with our Garmin Vivo Active, we not only collected heart rate, but also GPS measurements, as well as acceleration or velocity. And with that, we are able to geocode the locations of where the workers are located and pair those with temperature data and heat index data. So one of the great things about the Charleston project is rather than focusing on temperature, we're moving a step further and looking at heat index, which is a much more superior method than temperature. Just the thermocrons for heat index are about $100 compared to the temperature ones are about $20. So that was a limitation of our previous work, but we're extending that in Charleston by looking at both relative humidity as well as temperature with the heat index. And so this is showing all the GPS coordinates for the entire study. This is the MUSC location as well as the Citadel. With each of these locations, we are using a GIS to classify them as indoor or outdoor locations, as well as in transit based off their acceleration. With the indoor and outdoor, the GPS can be inaccurate depending on cloud cover, or if they're indoors, it can be up to 5 to 10 meters of inaccuracy. So we are QCing these measurements by looking at their activity log. So we have really rich qualitative data in addition to this data we're collecting with sensors. And we're QCing it to try to get our best estimate of if the worker was inside or outside or in transit. And this allows us to make better comparisons and to kind of understand how their behaviors change as the temperature increases or decreases, and allows us to make comparisons with weather stations by only using the outdoor measurements. And so these are a few just hot off the press maps showing heat index exposure just for those outdoor measurements. And you can see we are recording some pretty high heat index values, particularly in the Citadel locations. And then our other location, MUSC, is here. And we are just using an empirical Bayesian kriging method as a first cut to try to get an idea of the temperature differences across our two study locations. And then this is one focused on just working hours. And you can, again, I think this is heat index. Yeah, you can see, again, a lot of heterogeneity and some real hot spots in certain locations. We're going to tie in land cover and try to understand, as well as the activity logs, to see what the workers are doing. Sometimes if they're like I don't know, we had a worker previously trying to fix his lawnmower, and he had like a really high individual experience temperature. So we're going to pair these different data sources together to try to understand why we're seeing such high heat index measurements in some of these locations. Okay, these again are box plots for 3 locations, and we can see that the MUSC grounds workers, the MG green, are experiencing the highest temperatures relative to the Citadel and the safety group. And these are notched box plots, so you can see it is a statistically significant higher temperature than the other 2 groups. We can also look at heat symptomology, and this is just a first cut. We have to do a lot more advanced analysis to really get an idea, but we are seeing workers from this Charleston project who are reporting heat symptoms, particularly hot, dry skin. And they look pretty similar right now as far as temperature distribution for days when there are heat symptoms compared to days when they're not. However, this is based off their qualitative activity logs where they record if they have a heat symptom. It does not take into account their heart rate, which Jen uses to get as a proxy for heat strain, which probably is a more accurate measure because it identifies exactly when and where that heat strain event occurs. And this is a distribution of the heat index across the time period. So we had a 2-week sampling period. The first week was a little rainy, and you can see that the temperatures are lower, but we do have one individual in particular who's recording a lot of really high heat index values. And I'm really looking forward to going into the details and figuring out what's going on there. But overall, week 2, we are seeing the higher temperatures overall. And we're going to pair this with some of the heat watch data to try to understand what's going on here, as well as the fine scale differences in heat index across our study location. And then lastly, this, for me at least, this is a box plot showing the distribution across time. You can see, so this is for each hour of the day. Surprisingly, the workers had a higher heat index at 5 a.m. As well as higher levels when you expect late morning, as well as early afternoon.
And as Maggie's already hinted at, we received the last batch of data on last Friday. So we have been binging this data, trying to clean it. It's messy, trying to make sense of it. And so I'm just going to do a really high level look at heat index across those key demographic variables. And so we saw that older workers in particular had higher experience of heat index during our study period. This is the first time that we've ever collected data on female workers, so we're excited. It is a small sample, but we have noted right off the bat that the heat index experience for our female workers is higher than our male workers. We were able to look across race and ethnicity, and just kind of we note that our non-Hispanic Black workers have higher heat index experience than non-Hispanic white and our 2 Hispanic workers. And then contrasting with our prior research, we see that workers with lower educational attainment have those higher heat index values. Interestingly enough, when we split out we looked at heat strain, whether or not a worker experienced a heat strain event, and we saw that the heat strain, those who did experience heat strain, there was a slightly higher heat index. But when we split out temperature and relative humidity, interestingly enough, temperature seems to be more related with heat strain in our sample of workers, and relative humidity less so, which may point to the fact that it's more than just humidity. It could be direct sunlight exposure for these workers. It could be their uniforms. It could be a number of factors that we haven't yet mined the data to determine. So as you can see, we're just getting started with this research. David Hondula and his group published a really cool paper this year in Environmental International, where they have put forth some heat exposure metrics that get better at characterizing the intensity, frequency, and duration of individual experience temperature. So we want to replicate some of what they've done and then pair it with the physiologic heat strain. We have a really unique opportunity to look and see how well our individual experience temperatures in the workers compares with those temperatures that are captured during the Urban Heat Island campaign. There's a lot of unexplored and underexplored research areas that we can potentially get into. We want to, first and foremost, use these data, report it back to our workers and our managers, and provide them some recommendations on safety measures that they can take, and ways that, and definitely be focused on ways in which these data can be used to enhance local climate resilience action, particularly around extreme heat. And as we all know, the Biden administration last week released a statement that outdoor workers exposed to extreme heat is a priority area. There's a number of federal agencies from NIOSH and NOAA who are tackling this issue. So this is certainly front and center and a really timely time to be looking at this topic.
Thank you so much, Jen and Maggie. We're super excited, and the collaboration has just been wonderful with you both. Maybe we take 5 minutes and see if there are any questions, and then we'll shift over to Chip. There have been a few questions in the chat, and the colleagues who are on the phone are also sharing some good resources. One interesting question that Carl raised was about vulnerable populations. So Jen or Maggie, do you have any thoughts on how to characterize vulnerable populations when it comes to heat?
I'm sure we have a lot of thoughts. Jen, particularly Jen, and we've been working with vulnerable populations. We're interested in pregnant women. We've been doing secondary sources, as well as adolescents and mental health, and how surprisingly heat and mental health have a really, it seems to increase mental health events with high temperatures. So we've been doing work in that area too. And I'll let Jen talk about maternal health, because that's really, she's been the PI on that project.
Yeah, we're really interested, and we know that heat vulnerability really changes based on age and life stage. And there's a number of factors, whether or not an individual has insurance or access to medical care, that influence climate vulnerability or vulnerability to heat. So we've kind of been taking a closer look at pregnant women, because we know that extreme heat is actually linked to preterm birth and low birth weight babies and a number of other maternal health complications that not only has risk for moms and babies in that acute exposure period, but also later on down the road in the form of chronic morbidities. But I think one thing that I would like for us to do is kind of get better at partnering with those frontline communities, those groups that have largely been left out of these climate resilience discussions, and maybe even take wearables to these groups, and even health professionals to kind of bring this issue front and center in Charleston in particular, who's been very focused on flooding as a hazard for some time.
Thank you both. And maybe just to add on to that, we had a fascinating discussion with the Charleston tourism team as they described what they were seeing as visitors who were not from the South, not used to the heat and the humidity, come to do a walking tour on a day, extremely hot, extremely humid, wearing jeans and heavier clothing, and really kind of getting in trouble pretty quickly. In DC, we saw similar, where the health department there had raised a concern about visitors. You're on your vacation, not many hotels say, watch out, it's going to be hot and humid today and you need to be careful, and here's your hydration station, right? Just encourage people to get out there instead. So I think it just broadens the definition of vulnerability, to think about these temporal experiences, and then more fully to think about the workers who are under pressure to perform, with pressure being a key criterion, like the factory workers who are in unconditioned spaces. They're not outside, they're inside, but it's quite difficult to monitor, right? It's a great question. We're going to run out of time if we don't move on to Chip, though, and I'm sure that will generate questions as well. If anyone has questions, please put them in the Q&A box. And Chip, I'll turn it over to you.
Okay, thank you very much. And let me see if I can share my screen here. Okay, just want to confirm that you see my screen.
Yes.
Okay, great. All right. Well, thanks so much, Janice, and I just want to thank everybody for the opportunity to present here. So what I'm going to talk about is sort of the heat stress research we've been doing with Cisa and with the Southeast Regional Climate Center, and some of the applications, including a tool that forecasts heat stress. And so I'm just going to start off here. I just very quickly just want to say a little bit about our sponsors. So both these projects are funded by NOAA. I direct the Southeast Regional Climate Center. We do a lot of different things, but really in the work I'm going to present here today, our focus has been largely on developing tools. So taking weather and climate data and translating that into forms that are going to be really useful to different groups and so forth. And Cisa has really supported a lot the research that we've done here with the heat, and so I'll be talking a bit about that. So first off, so you've already heard a lot about heat, and you have some sense that it really varies a lot. We know we have the urban heat island where it's generally warmer in cities. We've been doing a lot of work looking at how heat varies on a very localized scale. And so we see there in the bottom left some instruments. So there's an actual weather station that you see there on the right. And we have a wet bulb globe thermometer, and I'll describe that here in a second. And we also have a Kestrel device that a lot of high schools now use to measure wet bulb globe temperature to determine whether they can practice or not. So just a quick background on heat stress. So Maggie was just pointing out that that the heat index is a somewhat better measure of heat stress because it takes into account not only temperature but also relative humidity. Well, it turns out there's some other variables that influence temperature, and a big one, and it's something that I'm going to really focus on a bit, is wind speed, or the degree of ventilation that you're getting. And basically, when the winds aren't blowing at all, and it's already, let's say, if the heat index is high, the heat stress imposed on a person is going to be much greater. And then I think solar radiation is rather obvious, right? If you're out in the sun, it's going to feel somewhat warmer. The heat stress is going to be greater. But even more than that, the incoming solar radiation, the background radiation is very important. And so Janice was talking about some work that they did, I guess the summer before last, looking at the skin temperature of surfaces and finding huge variabilities in that according to the types of materials and so forth. So anyway, when we put all of those together, we come up with something called wet bulb globe temperature. And so there's a device that will actually that measures it. And then there's like Kestrel instruments that are very portable, and what we used here in our Charleston work that does a very, very good job of estimating what the wet bulb globe temperature is. Now, more and more states across the country are developing very strict requirements around wet bulb globe temperature. And I just show you here one example from North Carolina. So we have flag levels of wet bulb globe temperature. You see there less than 80, and you can look over there and it says unlimited activity. So there's no cautions whatsoever. We go to the green flag, which you're encouraged to monitor for any symptoms of heat illness and so forth. So going to yellow and then red and black. And when it gets to the black flag, which is 90 degrees or above, that's when you're required to suspend practice. And so North Carolina has these guidelines, South Carolina and Georgia has them now. Virginia does not have guidelines. So it's very interesting how it varies from one state to the next. And unfortunately, when we hear about the death of an athlete, that sometimes that seems like that's what it takes for states to basically start taking actions here to monitor the heat. And I'll just mention that OSHA also has strict guidelines around wet bulb globe temperature. Oftentimes this is and usually this is in indoor environments. And so you can see the different flag levels there with, with the higher values of wet bulb globe temperature. So as the wet bulb globe temperature gets higher, you're required to take more frequent rest breaks, make sure that workers are taking in water more frequently. Okay, so we've done a lot of work in the last couple of years with wet bulb globe temperature. And one little project that we did is we took basically state-of-the-art data. It was basically a blend of surface observations of temperature, humidity, wind speed, and also cloud cover. And basically that's married with some model data, basically weather forecast model data. And anyway, we took this very high resolution data set and we plotted it up. And I just wanted to show you one map here to illustrate how wet bulb globe temperature varies across the broader southeast here. And so the areas there that you see that have the dark reds, those are the areas that in a typical year, heat season, May through September, have the greatest number of hours of black flag. And so you see the pattern there. Generally speaking, the farther south you go, the higher it gets. But we also see too that there's influences of the bodies of water there. And if you look basically, and I'll use my mouse to point it out, if you look right along the immediate coast, and this even just barely includes the city of Charleston, you see that the number of days in which you have 1 hour of black flag or greater is actually a little bit less. And so our research reveals a lot of that has to do with the wind. You get sea breezes that develop in the afternoon, and we found that happening with Charleston. And so just getting that breeze can make a big difference. And I just showed here a plot that illustrates this. So this is a plot that has wind speed here in the horizontal and wet bulb globe temperature here. This is a slightly different scale where we're showing 92 as black flag and greater. But we take sort of a typical day, let's say in the southeast, and really maybe even a little bit below normal, temperature of 86, a dew point of 70. That might yield a heat index, of maybe 92 or 93, something like that. And so if we look at the red line here, this assumes that we have totally clear skies. So we have bright sun shining through. And so it shows you what the wet bulb globe temperature is if the wind is averaging about 3 miles an hour. So the wet bulb globe temperature is 88. And if the wind speed just goes down 1 mile an hour, the wet bulb globe temperature goes up to 91 degrees. And so that's 1 flag level greater. Go down to 1 mile an hour, and the wet bulb globe temperature then goes up 3 degrees. And so there are a lot of days in the southeast in which the winds are not blowing very much. And so that's going to make the heat stress greater. That really increases wet bulb globe temperature. Now, when you scale down and you think about this in a city, obviously there's lots of buildings and so forth. That slows the winds down more. So you have an urban heat island that's already there, and then you have lots of buildings that slow the wind down. And so that can make certain places really dangerous. And I'm going to show you here in a few minutes some really preliminary results that we got from our Charleston work. But just a kind of more of an illustration of some work we did here in North Carolina, we went to a number of high school campuses, and we basically, and this is through the help of the North Carolina High School Athletic Association, we developed a relationship with a number of trainers across the state, athletic trainers. They're the ones that are typically tasked with measuring wet bulb globe temperature on their practice fields. And we went down to Carolina Beach, just right beside Wilmington. This place is very close to the coast. And I show you here a Google map, and it's a very large school. I mean, it has a big campus. It's very open. The practice field is right here, basically to the southeast, about as a crow flies, maybe about a mile or so is the actual beach. But they get, on a lot of days, they get a nice breeze coming from the beach. And so this is a well-ventilated place. And what we generally found is there's a lot of days that it's dangerous there. Indeed, the humidity is really high. But because of the breeze, the wet bulb globe temperature isn't quite as great. Contrast that with Cedar Ridge High School in Hillsborough, North Carolina. So this is in the Piedmont. This is just north of the triangle, specifically just north of Chapel Hill. So this is a hilly landscape. You can't appreciate it here on the Google image. This is a relatively big campus, not as big as Ashley High. That basically most of the buildings are up here. They're on top of a hill. Well, the practice field, at least for the football team, is down here in a pit. So it's in a low-lying area. And there are, and right adjacent to that are some areas that are basically wetlands. And there's trees that are on 3 sides of it. So this is a place that's extraordinarily sheltered. It's also a place in which the humidity is a bit greater. And so consequently, the wet bulb globe temperature can get to extraordinarily high values there. And in fact, when we first visited the site, and we had just met the athletic trainer, she was telling us she thought there was something wrong with their instrument because sometimes it would read ridiculously high values, like 97 for wet bulb globe temperature. And that's way, way up in the black flag. And she was having to tell the coach quite a bit. She'd shake her head and say, you can't practice. It's too hot. But anyway, she was convinced of that, but we did some measurements and determined, in fact, her instrument was reading accurately. So anyway, this short story here really illustrates how the local conditions, the local environment plays a huge role in the values of wet bulb globe temperature. So we've developed a tool that predicts wet bulb globe temperature. I show you the web link right there. And I don't have time to go into the details of the tool, but basically it ingests hourly gridded National Weather Service forecast. So they have their forecast grid. So you go to if you click on any of their maps or whatever and click a place, it'll give you a forecast for it. And so we basically pulled the temperature, the humidity, the pressure, the wind speed, also their forecast of degree of cloud cover. And then we had a calculator that provided the sun azimuth angle, so the angle above the horizon. And so we have a very sophisticated routine that translates that into an estimate of wet bulb globe temperature. And so we run the tool a couple of times a day, and users can go to the tool. And this just shows the website for it. And basically, the user identifies where they're located on a Google map. If they don't know where they are, which unfortunately is happening more and more, there's the box there where they can literally put in, say, their high school name or whatever. So they populate, they basically populate the box, they hit the submit button, and then you get a forecast, which you see down there at the bottom, and I'll expand that out there. And I don't have time to go into the details of it, but this is a forecast basically. So the user was basically using the tool on Monday, and it shows for the remainder of Monday going into Tuesday, and through the day Tuesday and the day Wednesday, the predicted hour by hour measurements. After 2.5 days, it goes to basically three hourly forecasts. The National Weather Service doesn't forecast hourly after that. But the black line here shows the predicted wet bulb globe temperatures, going into the future. You can see the peaks here are in the afternoon, and then it going down rapidly in the evening hours. You notice the shaded area there from our engagements with the high school trainers. They said, it'd be really useful to know what it is in the shade. And so in the very bottom area of the shaded area here, or the grayed area, is an estimate of what the wet bulb globe temperature would be if you're practicing in the shade. And so some of them said they had the ability to adapt, that they could find spaces in the shade. And also, as we get to the shoulder season in the fall in particular, the days are getting shorter, the sun azimuth angle, as you go late in the afternoon, that basically you can get a much more shaded landscape. So they have somewhat more of an ability to adapt to that as they go into the fall there. Okay, so currently what we're doing, we're in the process of tuning the tool to the local landscape. And so the Charleston work, which I'll show you in a second, is going to help us out a whole lot with that. So the National Weather Service forecast grids, they don't really hardly take into account how urbanized the pixels are. They certainly don't take into account what's called surface roughness, how many buildings there are and that kind of thing. But we're through Jordan Clark's PhD work, we're coming up with some methodology where we can get very high resolution satellite data, estimate how rough the surface is, basically how sheltered it is, and come up with an estimate of the wind speed. And so anyway, in that way, then when a user clicks a place, we can zoom in maybe to about a 10 or 20 meter scale and give a good estimate of what the forecast should be for that location. We're going to continue to engage with the high school athletic departments. And you'll be happy to hear, because I know a lot of you are in the Northeast, our tool only works for the South now and the Southeast. Well, we're going to expand it to the entire Southeast at the beginning of the next heat season. So that'll be May 1st. And of course, we want to expand the tool to other sectors. So to this point, we focus on high school athletics. So we're really interested in outdoor workers. And there's other groups too. And so there's a lot of work that needs to be done there, I think, in terms of finding the appropriate flag levels for wet bulb globe temperature. Okay, so just have a few minutes left here. So I just want to say a few things about what we did with the Charleston wet bulb globe temperature study. You see here lots of plots of wet bulb globe temperature being measured different places. And this sort of illustrates in some way the heterogeneity of the landscape. And of course, we were very intentional in where we were measuring it. We really wanted to find some really hot places. We wanted to find some relatively cool places. We also measured in some places in the shade. And so we wanted to get as much variability as possible. And not only variability in terms of the space here in the medical district, but also in terms of basically different times of the day, because we know the sun azimuth angle changes obviously as you go through the day. So our goal then was to basically estimate the microscale heat stress in an urban setting. And we're using this data to improve our forecast tool. Charleston, South Carolina is a perfect place. It is very, very challenging. I mean, you have the heterogeneity of the urban landscape, but on top of that, you also have the sea breeze that typically comes in during the afternoon. And also Charleston, as a lot of you know, is a peninsula. So there's bodies of water around it. So that makes, places where the humidity is going to be even higher. When you get into late summer, that's shallow water. So the water temperatures can be in the mid and even in the upper 80s. And so, of course, as water gets warmer, it evaporates more water vapor in the atmosphere. That makes the humidity higher. And of course, that's another concern that you're probably aware of with climate change, right? It's not just that it's getting hotter, but our oceans are getting hotter as well. That means more evaporation. That means a more humid atmosphere. So it looks like that got moved there for me. But so that just shows just a map of the campus there and some of the different places that we measured. And so I want to just highlight just a few interesting things that we found. We're still, like Jen and Maggie, we're still processing the data and so forth. So this is a map here that shows a day that we are actually doing reconnaissance, Jordan and I. And the blue here shows basically the sea breeze that's coming in, okay? And it's actually coming in from the south-southwest. And so the winds are hitting these tall buildings here. We didn't even think about this, but it creates what's called a rotor effect. The wind hits these tall buildings, and then the flow just basically gets directed down to the surface. So it was very breezy. I should say relatively breezy in this area. And then over here, there was no breeze at all. And so the winds here were blocked by this tall building. And so as we walked around parts of the campus where there were tall buildings, we noticed, we kind of noticed this effect here. And so there's some real differences in wind speed over very small areas. And so one thing we want to do is sort of quantify, what are the differences then in wet bulb globe temperature, and how's that, and basically then how's that tied to, where places are going to be the more dangerous. So this just sort of shows some real preliminary results. So that sort of one histogram there just shows all the measurements from the entire study. So the study was over a period of about 3 weeks. And so our average measurement was almost in the red flag there. So it was just shy of 88. I should point out, I should have pointed this out in the beginning, the wet bulb globe temperature scale is not like the heat index scale or the temperature scale. Oops, I don't know why it's doing that. But anything black flag or greater, is really dangerous. And so you can see that probably about 15 or 20% of our observations at least were in that really dangerous category. I will mention here also that, and this is from work that I did with Maggie back when she was a PhD student of mine, and we were looking at temperatures across North Carolina and the rates of emergency room visits. She showed you the plot of that and how much it varies. One thing that her research revealed was that the vast majority of days in which people suffered heat illness and had to go to the emergency room were days in which the temperature wasn't that much above normal, okay? And so she found that when it gets really the really hottest days, then people are really beginning to do things. But it's on days that are kind of hot that you got more people out there basically working really hard. And so the next plot here just shows that there's much variation, but generally wet bulb globe temperatures go up basically as we go through the day. And in Charleston, we found that around 1 o'clock, which is around solar noon, that's when the wet bulb globe temperature typically was the highest. Okay, and just want to illustrate one difference we found, and this is over a very, very small area. I think these measurements were like on the order of 10 to 20 feet apart, but we basically measured it over an area that had mulch, and then there was some pavement, and it was just a narrow strip of pavement nearby there. And so we found that the pavement, basically, that the average wet bulb globe temperature was on the order of about 2 to 3 degrees greater. So just a real vivid example there of just the materials that are there locally and how much that influences wet bulb globe temperature. Okay, with that, thank you very much. I have the link there to the tool. A couple of quick acknowledgements. Jordan Clark, my PhD student, also Jordan McLeod produced the map, and also Sandra Rain at the Southeast Regional Climate Center. She's contributed to this. The North Carolina High School Athletic Associations helped us out tremendously. And then we were very successful in recruiting citizen scientists in Charleston. Okay, thank you very much.
Thank you, Chip, for sharing that. We're all super excited to see the data as you and Jen and Maggie and Kirstin and Jordan go through it all. We don't have a specific question yet about the convergence tool, but I just wanted to point out, you're talking about the entire East Coast expansion, right? Starting May of next year.
That's correct. Yep.
So it's an opportunity for those on the call to potentially collaborate, and in mirroring the kind of sampling that you were talking about there, to think about how to use the same kinds of tools up here, correct?
Mm-hmm. That's right.
Yeah.
Yeah.
So if you have any questions for Chip about the tools that he's described, please pop them in the chat. And in the meantime, I wanted just to tackle a couple. One, I wanted to identify that Kirstin has joined the call. Kirstin, thank you. If you want to turn on your video and say hello to everyone.
Hello, sorry about that. It was, I thought I was going to slip out of class for 15 minutes, but life stepped in. They needed me.
That's true. That's true. So I had an interesting question, and maybe just see if anyone has feedback on this, but I'll start with you, Kirstin. I think you might have seen something about this recently. Carl asked a question about the relationship between extreme heat and cognitive performance. Any thoughts on that? Start with Kirstin, and then if anyone else has something to share.
I haven't done any work on it outside my expertise, but I have been seeing a number of articles. There seems to be a research team working on it, and I'll put a link in the chat to a piece on heat and learning, with the suggestion that extreme heat being particularly damaging to things like PSAT achievement scores, and even counting for a substantial portion of disparities between in racial achievement that we're seeing. So I would love to have someone who knows more about how to do those heat health studies look at this, and some of those people are on the phone. Let me put that link there where you can get a hold of it.
Thank you. Maggie, did you have anything on the cognitive question?
So the only experience me and Jen have is really with mental health, which could kind of correlate. We do see, for some reason, across the world, when there's higher temperatures, we see more mental health events. There's a lot of hypotheses for why this might occur. One hypothesis that me and Jen really want to look into is drug interactions and hydration. Perhaps that's playing a role. But yeah, it's a phenomenon that's observed. Yeah, increasing temperatures, increasing mental health events, increasing suicides as well.
Jen's nodding. I think that means she's good with that. I can just say, in working with the Urban Lab at Penn, one of the team members there with Eugenia South, Nicole Thomas, they had raised that in West Philly, there were some comments that when it's hot, more people die because of violence. So there are more people shot on hot days in West Philly. And that was just a neighbor commenting about how climate change is relevant there. Chip, we do have a question for you on wet bulb globe temperature. How well connected is the CERC WBGT with the National Weather Service WGBT work? Are you collaborating and validating each other's predictions?
Yeah, that's an excellent question. And I didn't get an opportunity to elaborate a little bit, but the National Weather Service has an experimental tool for predicting wet bulb globe temperature. And we had a meeting with the team developing that, and we know that they've had various challenges. It's not easy to take just standard meteorological variables and estimate it. And we found that one thing they were doing, and just one example in their model, is that they were taking wind speeds at 10 meters. So that's when they forecast the weather, it's at 10 meters. And they were using that wind speed as opposed to the wind speed, say, at 2 meters, which is where people are located. And believe it or not, just that small difference in height, we found through our research, makes about a 2 degree on average, at least on a sunny, very warm day, can make a 2 to 3 degree difference in temperature, in wet bulb globe temperature. So they now have what they call downscaled it. And so their tool is doing somewhat of a better job. Now, they still have challenges with the humidity. But what I will say is we've done some validation work with our tool, and it does a really good job. And I will say the biggest errors with our tool are actually errors in the National Weather Service forecast, which is understandable, right? Because you can imagine obviously in a climate in the South, and this would apply up in the Northeast as well, late in the day, you get convection, you get storms, and sometimes you can't forecast those much in advance. And so a lot of the errors are really around cloud cover or the convective debris with storms and things like that. But anyway, yeah. So the short of it is we're collaborating with them, and I think, and I'll just say too that that's a huge challenge right now. It's like we know wet bulb globe temperature provides the best measure of heat stress, but how will we be able to effectively communicate that to the public? And it's already challenging enough with the heat index and so forth. So anyway, there's a lot of collaborative work that we need to do on that.
Thank you. Thank you. We have just a couple more minutes to go through some sharing before we go to the large group Q&A. So I'm just going to share briefly where we are with the heat watch. I think I mentioned early on that we do not have our data yet back. The CAPA team is working really hard across the country to get data back to all the teams, but I thought it might be helpful to show you how we contextualize the routing in case any of you want to apply for this next year's Heat Watch program. So for Charleston, we started by looking jurisdictionally, and I'll just click through these hopefully quickly. Then we started to look at the council districts, thinking we needed to have support. We also laid out the geography in 1 square mile grids because the Heat Watch program functions on 10 square mile components, and each component then has its own associated cost. We then started to subset into the way that the community identifies the work areas, so the nomenclature that the community uses. We then started looking at areas that have an importance, like I think the Heat Watch program calls it points of interest. So where the carriages line up for the tourists, where people go to see particular parks. The GIS team at the city also said we should look at the subdivision age because it is a good indicator of what was done in the built environment, and worked with us to map out those age groups. And we looked at social vulnerability issues using SVI. We also looked at income, educational attainment, typical ACS components, age, insurance coverage, life expectancy, And when you start laying these over those heat maps that we showed early on, it's a pretty telling message. And then land cover types. And because of where this is, one of the things that obviously we needed to do is to pull out all of the wetlands area. And in excluding those areas, we were able to loop in part of North Charleston as well. We also did an NDVI to look at the health of the vegetation. And I think that this is important. So if any of you on the call are interested in pursuing heat watch in this next cohort, one of the things that we would encourage is not only kind of mapping out the geography in the way that you begin to look at these indicators relationally, because that was part of our application process, but also to think about the complement between these other research programs. So when we filled the application, we were able to describe the work that Kirstin and Stafford and Jen, Maggie, Chip, and Jordan would be doing in parallel with heat watch, and how those three things will come together in the research analysis, and how these were related to ongoing work with the master plans of those three institutions, the billions of dollars investments that are coming, and the comp plan update for the city. So that context setting was super important in terms of really understanding why this heat watch season was an important one for us to participate. And I'll stop there. A minute past our end time, and just ask Franco to maybe help us go through any Q&A that others might have. And again, thank you everyone for the presentations.
And thanks to you all. This has been a tremendous amount of information and really helpful to us. I'm sure many of us are, I mean, just judging by the number of comments, there's a lot of resonance here with the things you've talked about. I wanted, before asking any of the questions, I've consolidated some of them. I wanted to just go back to Jody from Esperanza and give her an opportunity just to sort of, from her perspective in the community that she's working in, ask any questions. Jody, if you'd like to do that.
Sure. Thank you so much, Franco. I'll keep it short. I know we're over time. And my question is really kind of a general one, given that in all the information that's been presented today, it's clear that there are many, many ways that individual people, the institutions that they work for, or others that are involved in the circumstances of their lives, ways that all of those different spaces can have some kind of action or intervention to help people to deal with the effects of heat and to live healthier lives. And so I'm just wondering if there is any panelist who has had an experience, whether emergent or something that's proven out over time, to be a really effective way to translate some of these, the lessons learned from the research and the data, to equipping communities and people to deal with their situations. I think we heard a little bit of that around the folks who were wearing temperature sensors on the job and how they were able to adapt behavior. But I'm wondering how we bring these lessons into communities in order to help community organizations and residents to respond to their own circumstances.
I'm just going to ask Jen and Maggie and Chip to rejoin on video. And Chip, I think it might be good if you could speak to what you've seen from the high school teams, because I think that's a very applied one, and perhaps we can see what others have to share as well.
Okay. Yeah, so I'm thinking, when it comes to communities, and I mean, I think the hugest challenge is being able to target warnings to different groups. And I mean, it's one big challenge to begin with, if you're the National Weather Service, so you're tasked with providing forecasts and warnings, heat advisories, heat warnings, and so forth, and getting the messaging out there. And traditionally, the Weather Service has used the heat index, but we know there's a lot of cases where the warnings are not getting to people, and there's all these questions around what does that mean exactly? What does it mean for me? And I think the research that you can see here, it's well illustrated, is there's tremendous variability in the heat environment, and then when you have an individual who's basically who's in the heat and they're starting to show symptoms and so forth, their body is reacting to that, they're perspiring. And so anyway, there's a micro scale environment that they're interacting with there. And so how can we more effectively target different groups? And we've done enough research to know that there are groups like outdoor workers that are really vulnerable and all that. But how can we take, say, forecast information and translate it into forms there that are going to be useful? So from my perspective, it's more that the question is really a burning question. And I don't know, we have a lot of work, that we need to do on it.
I'll chime in behind Chip. I agree. We've got a lot of work to do. The evidence based on individual experience temperature is relatively new and emerging, but I will say there's some really cool research in the air quality arena, engaging citizen scientists around air quality. And out west, there's been some efforts in which citizen scientists in collaboration with research scientists and policy decision makers have begun to make some local do some local policy making using these data. And I think we can get there. We've got a little ways to go, but I think that's one leverage point that I'm hoping we get closer towards.
And as a final follow-up, I just want to reiterate how important it is. We did give our data back to the workers, and it was really informative for me. Like, I assume everybody loves maps, and so we made each worker a nice, like, beautiful temperature map, and they actually just liked knowing it in like a table. They didn't even like the maps when we did the survey. So it was really informative, engaging with that community and really hearing what was meaningful for them. So.
Maybe just one more, Jody. There's some really interesting work in Seattle and King County, where one of the leaders from the health department worked with a Asian American community to develop a cartoon about cooling foods and cooling strategies based on clothing. And it's really friendly. It's a little flip out that you might make on an 11x17 printer, but it was all culturally relevant. And I believe it's in multiple languages. And Kirstin's team has done some things in the Carolinas like that.
We've paid attention to the need to just do good translations about the impacts that people are seeing and produce some things for people in different types of occupations, but there's so much more to learn. And I think a lot of opportunities to go further than we've gotten so far. One of the things I was excited about is the collaboration with the South Carolina Interfaith Power and Light. It's a network of, Interfaith Power and Light is also connected with the Southeast Faith Leaders Climate Action Network, which is part of another Earth Justice movement through interdenominational congregations. And they have a large effort focused on thinking about resilient congregations. And it's such an important institution for many people that the churches, as they think about themselves, fill an intermediate role between the individuals and the government as an institution that serves a lot of people and creates connectedness. And so I've been happy to have the Cisa team in conversation with them about how we can bring lessons from this into the work they're doing that also addresses energy efficiency and energy poverty.
Thanks for that.
Yeah.
Thank you.
Just one more quick follow-up on, sort of specific localized work. I mean, of course, the whole presentation was about how, these differences in location and in local environment, microclimate translate into differences and then the individual attributes of individuals and how they're using space. But I'm just wondering, a community like Hunting Park, for example, that knows it's experiencing extreme heat, and knows it's in a heat island. If you had a weather station in sort of a representative portion of that community, a question to Chip, I mean, could you use your model to develop a really community relevant measure of wet bulb globe temperature that could be used in that particular neighborhood? And of course, it would depend. I mean, you'd have different thresholds depending on how people are using space. But have you done that in a very localized way?
We haven't done that yet, but our work with our model is to scale it down more so that we can actually estimate, just about on a neighborhood block level, what the wet bulb globe temperature is. And so I'm expecting our model, the next iteration of our model, I'm hoping we're going to be able to do that. There's a lot of research that's behind it because we have to employ very high resolution satellite data. But that would not even require a weather station there. But the next step, and really the huge one, is like, okay, that's great. We can do that. We can get a wet bulb globe temperature. So now how can we translate that into something that a community could really use and really get around? And that's where we really got to do a lot of research.
Yeah. Well, we do have an opportunity for you all to give some useful information to a National Weather Service representative here, a meteorologist from the National Weather Service, Robert Byte, sent a comment early on. He's in Charleston and mentioned that there's consideration of changing the heat advisory warning threshold for South Carolina Low Country and Georgia Coastal Empire, and is wondering, I guess, if any of your research so far might, if you might want to give any guidance on what is the appropriate threshold to consider. I mean, he's talking about heat index, but any thoughts there to give Robert?
I'll speak to that. I'm not real familiar with the rates of heat illness. I have little familiarity with heat illness, obviously, in that area, but from the work that Maggie and I did in North Carolina, what we found is, again, a lion's share of people who came to the ER with diagnosed heat illness occurred on days in which the temperature wasn't that much above normal. And so it's like, what that suggests is that we need to lower those thresholds for heat index. And I don't know, Maggie, if you wanted to add on to that a little bit.
Yeah, I think lower those thresholds, or perhaps target, these outdoor occupational workers for these lower temperature thresholds, or pregnant women. So some of these vulnerable populations, perhaps they would have a different warning threshold than the general population. Because in both studies in North Carolina, looking at ED visits, as well as Jen and my eye button temperatures, we're seeing that same phenomenon: higher heat exposure, more ED visits, more heat strain at those climatologically normal but higher temperatures that don't meet the National Weather Service criteria for a heat advisory or excess heat watch. So we're seeing it in both studies. So it's definitely an area we need to move more into.
Yeah, and I'll just real quickly, I'll add on to that too, that the fact that the temperature is not much above normal, and you think, okay, that means the elderly and the young would be really impacted. And Maggie, I'll steal more of your thunder. I already have a lot here, but it turns out, that it's healthy males that showed by far the highest rates. And we know that was a gross underestimate, right? Because males, by and large, don't go to the emergency room. But point being is, it's a lot around heat exposure. And so, yes, we need to really, the Weather Service needs to do more targeting, but it's a real challenge, right? Because they don't want to have too much, you could get a whole lot of complexity in your forecast. So you got to really think of some savvy ways there of how you can, when you're providing more specific information, how can you get it to people and so forth? And so anyway, there needs to be research, I think, on that.
So another question, I mean, as you may know, this series has talked about not just climate risks, but also sort of mitigation strategies, adaptation strategies, and there's been an interest in green strategies, green spaces, nature-based solutions. And I'm wondering if any of the work, you've done such localized measurements, if any of the work that you've done so far has sort of defined specific green space strategies, or of course, we know green spaces lead to cooler areas, but configuration, I'm just thinking about how green spaces are designed, their orientation with respect to buildings, types of vegetation. Is there anything that you can conclude so far about that?
Well, I can't conclude anything yet, but we have some rich evidence now to suggest that that orientation matters a lot. That if we can, when we do our redesigns, if we can orient public spaces in ways such that you get more of a breeze. And as I was illustrating, there's such sensitivity with wind speed. If you can just increase the wind speed by 1 or 2 miles an hour, you can reduce the level of danger, by a flag level. And also too, and I think, and Janice, your work the summer before last showed it, that when you look, say, for example, at the skin temperature of turf, artificial turf versus grass, there's a big difference there. And so being very mindful of the materials that you're using. And so that coupled with maybe, and to whatever extent it's possible, reorienting building structures, maybe creating funneling effects where, so a place like Charleston, the vast majority of days, the winds are blowing from the south-southwest in the afternoon when it is the warmest. So there's a lot of possibilities there, but we need to do more. This was really for us a pilot study. We need to be a little bit more systematic and go back. But anyway, we've got, I think what we've shown is that there's a lot of possibilities here for quantifying how much we could improve or reduce the heat stress, by making various changes.
Maybe just to add on to that, because I think it's such an opportune time when you're in wherever you're all working. If there are capital investments being made, if this is not raised, it will not be addressed. The heat issues that we're learning more about and the material choices have just not been a big part of the design education, not in this way, not in terms of the transformation that material choices can make in terms of microclimates. So this group has been working with the Low Country Rapid Transit team to try to give feedback on station design so that wind channeling, like Chip was talking about, or material choices could help with cooling while people are waiting for those buses to come by. We've also talked to all the master plan teams, given that material palette difference that we showed on the chart. We've talked with the universities about things like, those sell a brick programs. They don't really make that much money and they're creating a really bad microclimate. So you maybe ought not do that anymore. And even in the planting strategies, the kind of monoculture of the grasses is much, much warmer than what we're seeing in terms of layered plantings in exactly the same, like 100-foot radius. So it changes the nature of the conversation when you see these as all variables in the design decision. And then when you couple, going back to the first of the presentation, when you couple the fact that all of these dollars are going to be spent to try to help with the flooding issues that are so real and so impactful, if every one of those dollars that has the potential to also help with heat reduction could be applied with that purposeful conversation happening, then those dollars get you a twofer, right? It's not just flood reduction, we can make a difference. But we can't just assume that the things that serve flooding will serve heat. We really have to think about that microclimate much more holistically.
I just want to chime in really quickly, kind of navigating back to the health perspective. Maggie and I just completed a study looking at the protective role of green space in maternal health in South Carolina. We use this new data set by USGS, the Protected Area Data Base, that provides a nice proxy for accessible and available park space. And we found that over a quarter or so of South Carolina counties and zip codes do not have accessible and available green space. We saw some really important relationships between moms in areas with low green space and higher maternal risk for gestational diabetes, preterm birth, and a number of other maternal health complications. We haven't folded in the heat aspect, but green space, I think, will be critical in the Southeast and something that we need to kind of take a finer focused look at.
Really interesting also, that I was thinking of that football field that is near a lot of green space, but actually because of the lack of wind, the lack of air movement was higher. So it's a complex story, but very, very interesting to think through. I wanted to go back to, there've been a number of questions about whether you're collaborating with this organization or that organization. And I remember in the very beginning, Janice, you talked about this iterative building of relationships. And I know in some of the climate resilience efforts that we've undertaken in Philadelphia, we've been talking a lot about who gets involved at what point and how do you build the coalition. And I wonder if you could talk any bit about about the process. I mean, of course, you showed all these partners, but about, who jumped on first and whether you feel that you've achieved the level of participation that would be optimal, or what groups have been hard to address or hard to include or engage in this type of work.
Sure, and I'd invite the rest of the team here to weigh in on that as well. This conversation was able to happen because the Charleston Medical District team members brought together the physicians who had witnessed their patients passing out. And the members of that network were open to recognizing the all hazards results from the vulnerability assessment, because without that, there wouldn't have been a Robert Wood Johnson application, and there wouldn't have been a call to Kirstin, and there wouldn't have been, and et cetera. So I think that the value of that network of the medical district and the value of this problem being related directly to the business of the organization, which is health care, right? So anything that would be negatively impacted patient care, or the patients as they were seeking care, like standing outside waiting on a shuttle bus or passing out on the way to get their appointment, that combination of the trusted relationships within the Charleston Medical District and the patient relevant commentary created the room for the conversation to happen, which then led to the grant and the wellness committee at the city and the Office of Health Promotion, and Susan Johnson has just been a huge advocate there. And I think the other thing is that this group, as well as those who are listed on the screen but not with us today, they have really reached into their individual and organizational networks to invite more people in. So your second question is, are we there? I don't think we're there because there's so much work to do, but I think that this healthy amoeba is continuing to welcome people into the conversation in a way that much of the resilience dialogue tends to not do, unfortunately. We tend to put up technical parameters that make it difficult for individuals who don't work in this area to feel that they can meaningfully engage. And the thing is, when you put health at the center of the conversation around climate change and resilience, when you put health at the center of design decision making, it just opens up the vocabulary in a way that our historically technically focused conversations didn't. So that's why some of the individuals that Kirstin was identifying and many of the individuals who are listed on that slide that we shared are here. It's because they have an expertise that is relevant, and that expertise might be deep community knowledge. It might be medical awareness. It might be, how in the world do I get these trees to survive salt water and temperature going up 20 degrees? And I think that's just super important. And I saw that Hunter is on the phone here. The other thing that's super important is the fact that we have a national effort that is leaning into extreme heat. In addition to what Jen raised about the administration, the NIAS team has been working so much and doing some really extraordinary webinars to, again, broaden the dialogue. So big shout out to them and the Global Heat Health Information Network. So when you have a global effort, and if you look at the last IPCC, right, last month when we were on this call, that's the one thing we're all sure about. It's going to get a whole lot hotter. So we need to crowd in as many as we can. I'm maybe a little preachy on that. I don't mean to be, but I'm really passionate about it. And I just want to invite anybody else to say whatever would be.
I just add that I think it's interesting that the heat topic and the mission of the medical district just let us connect to people on so many different layers so that the multiple agendas could speak to this issue and share the concerns. And I like there's a connectedness to it, but it's not particularly tight. And it's great that the message just comes from multiple voices, because I think that's often an important part of socializing it, that the conversation is taking place in lots of places through lots of different people.
Thanks so much for those answers. That's really helpful. This idea of sort of centralizing, thinking about how to curate the conversation and putting health focus is something that, everyone cares about their health, and that opens the door to talk about other things is really, really insightful. Honestly, we've had 22 comments in the Q&A. There's a lot of questions. We'll never get to them all today. But I wanted to maybe just talk, just sort of close with a question. Obviously Chip talked about a potential collaboration on validating or expanding the prediction tool into our area. There's folks here from various communities around the Northeast. If there are ways that we can collaborate on this, and there's sort of a crossroads and there's information or opportunities. I don't know if you want to talk, maybe close by talk about what you think the opportunities are for collaborating on some of this work. I think the folks who are attending here would be interested in hearing your thoughts. And I'm also would volunteer CC Run to kind of provide a crossroads, so to connect people together as necessary.
Chip?
Yeah, well,
You offered.
Yeah, I put it out there, and I mean, we really want people to use our tool, right? We're going to expand it up there, but very importantly, we want to get people's feedback on the tool, and it would be wonderful to establish some kind of dialogue and engagement, right? And so, what I would think about is maybe some kind of pilot study or something in which we're providing this information, but it's in a technical form. I mean, it's wet bulb globe temperature. What is that? But having a lot of thoughts around the communication of this and what might we do? And it could start off that we're going to be tuning the tool also. We want to be able to adapt it to different users. To this point, it's been adapted to the athletic community. But kind of put it out there. What would it look like for a community? What would be the thresholds of wet bulb globe temperature that would be appropriate for a community? And this is a challenging medical question, really, in a way. Like, when we talk about fit football players, that's one thing. But when we're talking about the general public, we're talking about people who are especially vulnerable, people whose health is compromised, older people. What are the thresholds of wet bulb globe temperature? And if you do a literature search, you'll find that there's a range of different definitions out there. And so part of this work is just trying to establish, for this excellent measure of heat stress, what are the appropriate thresholds, and then how can we effectively communicate that? So some kind of case study, where we take a group or a couple of groups in Philly or wherever, that would be very interesting. And so we're happy. I mean, I'm happy in terms of the tool and kind of working on the big scale there and really talking up wet bulb globe temperature. But I think, getting some researchers who are interested in these questions, and obviously people on the ground, that could really, work with the community.
That's really helpful. And I know also within the CC Run community, there are folks both in New York and Boston and Philadelphia who are using devices like you mentioned. So Jen and Maggie talked about the eye buttons, and we talked about Kestrel devices. And so there's all kinds of questions that come up about which sensors and how are the data comparable between one location and another using different sensors, et cetera. So I feel like, even in the measurements themselves, there's a lot of room for discussion to sort of collect information in similar ways across multiple cities so that you can compare in other ways.
I think we should put a pin in this, Franco, because it needs more conversation. There are lessons that you're learning and what Jody shared and what Karin shared that I think could walk back to Charleston and really help. And I just don't want to short circuit that. I would just like to put a bookmark up and ask that we do a follow-up conversation, if you wouldn't mind.
Absolutely. Yeah, we really should. And we are out of time. So I just want to thank all of you for this really insightful presentation. I mean, it's really exciting to all of us to hear what you're doing. And as you just said, I think we should continue this conversation.
Absolutely.
So thanks to you all, and please join us, the speakers as well as everybody else. Please join us. This is the first Wednesday of every month we do this series. Please join us next month, and I'll volunteer myself as the point person for continuing this conversation.
Thank you.
Thanks,
Thank you
everyone.
all
Thank
so
you.
much for sharing. Really appreciate
Yeah.
it. Jody, lovely to meet you. Thank you for sharing what you're doing.
Thank you so much for having
Thank
us
you.
join. Take care.
Bye-bye.
Bye.
Bye.